Guys, welcome to my YouTube channel. I am Denmark Aranas, a postgraduate medical intern, and I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a medical student usually tackle in med school. What you see there in the background is a red ribbon. That is a universal symbol for people living with HIV. If you find these videos helpful, please don't forget to hit the like button and subscribe to my channel and click the notification bell to be updated for my new videos that I'll be uploading every week. For today, I'll be discussing the clinicopathologic correlation of HIV and AIDS. HIV stands for Human Immunodeficiency Virus, while AIDS stands for Acquired Immunodeficiency Syndrome. HIV and AIDS are different from each other. HIV is the virus that causes HIV infection, while AIDS is the end stage of HIV infection. This is a very important topic to discuss because there is a spiking high increase in the percentage of number of new cases of HIV here in the Philippines. So we are currently having an HIV crisis. Shout out to my buddy, Merrizarose Laconsay, for helping me in um, creating this CPC for HIV. Thank you so much for your help, buddy. So we'll be discussing each section of this. Okay, so let's start. Here are the different risk factors for HIV and AIDS. All sexually active male and female, regardless of the age, are predisposed to having this disease. There is a number of people living with HIV who are pediatric in age, and that is really sad. So being sexually active, regardless of the age, is an important risk factor for having HIV. Plus, living in promiscuity, also practicing unprotected sex, and males having sex with males are very important factors to consider. In fact, males having sex with males is the most common transmission of HIV. It is very different from the past wherein heterosexual sexual intercourse is the main determinant. Right now, currently, in our age, it's males having sex with males, which is the most common transmission of this disease. Another risk factor is the IV drug use, wherein people who engage in drugs share infected needles. And then the needle stick injury. People who are working in the health department, they are the ones who are more vulnerable for needle stick injury. So we must always be careful, like for surgeons and even us, students, medical students. And also, there is a mother-to-child transmission of HIV. All of these risk factors, if they would be present, it increases drastically the chances of acquiring HIV that would now lead to HIV infection. And the common method for you to be infected with HIV is having contact with bodily fluids. Okay, and what are these bodily fluids that we have to keep in mind? These are blood, semen, cervical and vaginal secretions, and breast milk. Okay? Remember those bodily fluids: blood, semen, cervical and vaginal secretions, and breast milk. So once your mucosa is exposed to that bodily fluids, you would now acquire HIV infection. And here you see the structure of HIV. They have a glycoprotein in their structure that would now be responsible for the adherence to the cell. The receptors you have to take note of that they adhere to would be the CCR5 or the CXCR4 receptors. Okay, there you see the fusion of HIV to the host cell surface. And then the HIV RNA, reverse transcriptase, integrase, and other viral proteins would enter now the host cell. This viral DNA is formed by reverse transcription via the enzyme reverse transcriptase. And now it would enter the nucleus. And in there, it would be integrated into the host DNA, as you can see here. And then the new viral RNA will be used as a genomic RNA to make viral proteins, as you can see here. And then this new viral RNA plus the proteins would move to the cell surface and would form the new immature HIV forms. Okay? And then as the virus matures by protease releasing, it would now be released from the cell as individual HIV proteins. And here now would be the new HIV virus. Okay? So once you have an HIV infection, we would be presenting the acute HIV infection symptoms. These are very non-specific and they are flu-like symptoms. These include fever, lymphadenopathy, headache, body ache, sore throat, cough and colds, runny nose, and even vomiting. And also, if there are suspicious rashes, you could also consider HIV infection. From there, the virus would continuously replicate, and then our body would respond by forming antibodies. Okay? However, these viruses are really smart. They would now evade or try to hide from our immune system. So there would be an immune evasion. And once they are evading our immune system, our body would manifest as asymptomatic, but still, people infected with HIV are still infectious at this point of the disease. Even though they are asymptomatic, they continuously to be infectious. So it is a very smart virus because it tricks us and they want to be transmitted easily to other people. So you're having a false security thinking that you do not have any disease because you do not show any symptoms. However, you are still infectious. And then from the continuous viral replication, the virus would now cause cellular destruction, specifically of that CD4 T lymphocytes. And these CD4 T lymphocytes are important players in our immune system. So if you destroy these cells, it would lead to immune system weakness. And it would be a vicious cycle of destruction and weakening of the immune system. So the body would would be having an increase in the viral load. However, the CD4 T lymphocytes would continuously to decrease. And so it would lead to a point in time wherein the CD4 count would be less than 200. And that would now qualify us to diagnose the patient to be having acquired immunodeficiency syndrome, which predisposes the patient to have opportunistic infections. And these opportunistic infections would be the most likely cause of death of these patients. So this is the reference of our discussion, Harrison's Principles of Internal Medicine, 20th edition. I would like to end this presentation by giving you a message. If you truly love your partner, you will make sure to treasure the trust and always value mutual faithfulness in your relationship. You can see here in the picture my partner in life, Carmelo Bautista. Thank you for listening. Have a good day.